The first time I've heard that. Okay, great. Awesome. Well, we're going to go ahead and get started. I really love this book. This is my second time reading it through. Babies in Our Pizzas is awesome.
Which is so funny because I'm eating pizza. I didn't even put two and two together, but that's really funny.
Very funny. Very funny. Okay, so I wanted to start with kind of talking about her first birth experience, kind of talk about where bad practices were used in her first birth, and kind of like recognize some key phrases that she uses that kind of identify things that we're trying to avoid in birth spaces. So for me, the first thing that stood out was that she was worried about being gossiped about. And she was really, really concerned about what people like doctors and nurses and the people staff thought about her. And to me, that was kind of a first red flag. And then she says, with only random bits of education, I was not prepared for what the system had in store for me. That's on page 1, where she says, I laughed at birth plans. How could you possibly plan birth? Have you guys worked with people who laugh at birth plans and are really want to people please the hospital staff? Or felt that way yourself?
Like some of the friends, which I don't have kids yet, so I don't have my own experience, but my friends who I talk about like doula stuff with and like some more evidence-based stuff, they kind of like mock at it, kind of joke at it. And kind of like, well,
yeah,
so it's, I don't know. I think it's like two things. One, really, I think it's just one with the friends that I've had experience with, but I can see this being two things, like one of two things. One, they're just uneducated. They don't know, they're not aware. Hospital practice is hospital practice, and we do the right, like they do it this way because they're the hospital and they know everything. Second is maybe there's some shame, like there's some underlying shame and maybe even some like anxiousness about like, oh, I wish I would have known. I wish I could have done something different.
Yeah, I can completely see that. Have you run into anything like that, Jamie or Beverly?
I've had like a few clients and friends that are kind of like more of like, oh, this is the way that things are supposed to go. Let's follow the this is what the doctors and the hospitals say you're supposed to do, and let's just go with what they say because they know best. But then and I also have people on the complete other end of the spectrum. It's surprising I haven't had much of the middle, more of like the two extremes.
The middle is where we want to be. Oftentimes I find that the middle is where we want to be. If I find myself on an extreme of something, I'm always a little bit hesitant to say, well, if people, there's got to be, the other side has to have some good points, right? Most of the time. Yeah, for sure. So then I highlighted on page 2 where it says, what I didn't know then is that if you give up total control of your decisions and don't do any education or planning, you often end up getting the lowest quality of healthcare at the highest cost to yourself, your health, and your wallet. And I totally agree with this. I feel like one of the biggest things that, we kind of emphasize for our clients with KCWM's ministry is the importance of education to make informed decisions. We support whatever decision that you make, but we want you to know what your options are and what the evidence behind each of these options are so that you can actually make a decision. Do you guys feel pretty much the same way about that.
Yeah.
Let's see. Then when I was reading through this conversation, where they're talking about, you know, breaking of water, even though they're only 4 centimeters, like that's not evidence-based practice. You know, talking about just trying to make things go faster, which is something that you run into pretty often. And then
that just completely, like, it made me so upset when when her sister asked, like, why. The reason she got was because that's what we do. Like, for me, that's not good enough. Just because
Right.
that's what you do doesn't mean you should do it.
Yeah. And then just like that whole, I felt for her sister so strongly. I was like, oh, she knows. Oh, she wants to protect her, and like Rebecca is just not listening. She's just not open to it. I could just like feel Shannon being like, come on, sis. There's all the red flags, like stop. But you know, I felt that so much. I'm like, yeah, I mean, you can't. I apparently have a phone call from Cindy.
Yeah.
You must have forgotten that we have book club. And then on page 3, I really liked where she talks about how they provided continuity of care when the caregiver at your birth is the person you've been seeing throughout pregnancy versus like having a rotating on-call system. And that's something that's really great for us as doulas, that we really advertise that we have continuity of care and we're there with you, but we're actually with you for the entire time. Hi, sweetie. Throughout your whole birth as well. Like, we're not going to leave. And I think that is like super important. And I like that she kind of talks about that, and she goes into it a lot more later. Yeah, was there anything else about her birth story that kind of stuck out? Like on page 5, when she talks about how they wouldn't let her go to the bathroom. I had a client that experienced this. And it was, oh, good girl. Can you do it in the other room, please?
Why?
Because mommy is on a recording and that's very loud. Thank you. Like having to use a bedpan while in labor, that sounds horrible. Like I had a client that they wouldn't let go to the bathroom, let being a strong word, and she really wanted to be compliant. So I was saying, you know, you can go to the bathroom. And then she would be on the toilet for like maybe 2 minutes, and then they would come in and say, you need to get back on the bed. So it's crazy how this stuff is still happening.
I put myself in her shoes in that situation because, like, when I read that, my anxiety like skyrocketed. To feel chained to a bed would make me feel so claustrophobic, even though I'm in an open room, knowing I can't get up to go to the bathroom. That would drive me insane.
Mm-hmm.
Absolutely insane. And the fact that, like you just mentioned, it's still happening.
Stuff like that. Yeah. Yeah.
It's so sad.
Yeah. It's crazy. And then here she talks about starting to feel trapped, no food, no water, no permission to use the bathroom. It's just, you know, then nobody really knowing. And here on page 6, where the doctor says your labor is taking an abnormally long time. Like, it's her first labor to find abnormally long time. I mean, you know, these kinds of things, they really stood out to me as I was reading it. The actual like pushing of the birth, that was really just like, oh, I felt so horrible that she went through all of this. Purple pushing. And let's be real, I see purple pushing all the time. And, you know, we talk about it beforehand where we say, you know, there's not a lot of evidence behind it. And, you know, you're in the birth space and you say, hey, you know, remember we talked about how you don't really want to do purple pushing. And then they said, well, like in the moment, they decide that that's actually what they want to do. And we totally support them with that. But, when we're talking about, how having her strapped onto the bed wasn't research-based and all of that stuff, how it just all accumulated into being a very traumatic birth. Did anybody have any other thoughts about her birth?
It really stunned me how they just like took her daughter away from her after she was born, even though there was nothing concerning to the doctors of baby's health. And they just like took her away, and that made me sad because she really wanted to breastfeed and they wouldn't let her.
Missed that bonding time.
Yeah, missed. And when all those hormones are so high and good, just missing out on so many things. And then wasn't it that, or was this something, am I confusing stories? I'm trying to like look back as we're talking, but it was like several hours because she didn't want her baby to be bathed. Is that correct? Or she ended up getting a bath?
Yeah, I think she ended up getting a bath. She came back all being clean, and I think they gave her some formula.
Yes.
If I remember that correctly.
Just sad.
Yeah. And I have a lot of clients that prefer to keep the baby in the room just so that they can know exactly what's going on with baby. So none of that is going to be happening. Something that Rebecca Dekker actually talks about in one of her trainings, where she's talking about the hierarchy system in hospitals and horizontal violence that they experience. She talks about how the doctors and nurses sometimes just start going on a routine, and it's just normal for them to bathe baby or give them formula or a pacifier or whatnot, just depending on what their normal routine is. And it's not necessarily that they're not wanting to respect your wishes, it's that they're just going and like, oh right, like even if they remember, maybe they've already done it, and so having somebody who is with baby, or having baby stay in the room with you is really helpful, so that you can be like, hey, I didn't want that. And it's not that they're trying to be disrespectful, so they just totally get, you get in the groove and then just start doing things the way that it's very common muscle memory, just trucking the way that it goes, especially in a place where they're going to be taking care of newborns all the time. So having one that wants to be taken care of different than all the rest. But yeah, that was really sad. Okay, so then I put here, read highlighted section on page 14. So get to page 14.
Psychological stuff.
Let's see. So I put, some people feel incredibly satisfied and empowered after giving birth. Some people, in fact, are so excited by their birth experience that they make a career out of birth, going into nursing, midwifery, or doula work. And I wanted to know how this quote kind of reflects your doula work or your inspiration to join doula work. Jamie, do you want to start? You had a big smile. You unmuted yourself.
I'd say that's pretty accurate. I was like, with my first baby, I started doing a bunch of research about birth, like while I was pregnant, but then brought him home from the hospital, and like during my maternity leave, I'm still reading research about birth and pregnancy. Like, I was like, I'm so ready for the next baby. And from there, I hadn't actually heard much about doulas at that point. And as during my research, kind of discovered that that was a thing, and then started researching becoming a doula.
Yeah, that's awesome. What about you, Becca?
Well, I just always thought birth was so amazing. Like I've been so fascinated by it since I was little, just so not how it is. But I remember growing up watching A Baby Story on TLC, like in the summertime. I know it came on at 9:30 on TLC every weekday morning, and that's what I watched. I was just fascinated about the idea of this little human growing inside of you, and then you bring it earthside, and it's the most like magical spiritual experience. But yeah, I know there's a lot of people who struggle with advocacy and wanting things to be what they want and they dream about, because I know for me, when I have a child, God willing, I want it to be a very spiritual experience for me, and not just a thing, not just like this one moment. And being able to advocate for that and plan for that and prepare for that is super important to me. And I know it's super important to other women. So I'd really just helping advocate for that, like not necessarily advocating for them, but teaching them how to be an advocate for themselves is what's not just so empowering for them, but it empowers me too, which I think is really cool, because empowered women empower women, right?
Right, exactly. Yeah, you said it perfectly. Beverly, do you have anything you want to add? She is muted, so maybe not. Oh.
I have a horrible birth. The first one was bad, but I had postpartum infection, and my baby was critically ill. My desire to do it was more came around when I had grandchildren and to help my daughters.
Oh, how sweet. So were you able to attend your daughter's births? Have you been able to?
I attended the first one.
Great.
Her second one was a C-section.
Mm.
My second daughter had her first baby during COVID, so
Oh,
her husband there.
I'm sorry to hear that. All right.
The next one.
Yeah, definitely. When they're lifting all of those COVID restrictions, it makes it a lot easier to be able to attend things. Yeah. Yeah. For me, this was definitely my experience. I had thought about and was planning on becoming a childbirth educator when I had my first baby, but I actually didn't know what a doula was. I made it all the way through Bradley method class training and never heard of a doula, which is crazy in hindsight. Yeah, I had no idea. Yeah, I didn't have a doula either of my births because I didn't know. I found out what a doula was when I was researching other options to become a childbirth educator through. And then Bebo Mia was like, you have to become a certified doula before you can be a childbirth educator through us. And I was like, what's a doula? Oh, wow. That's crazy that I didn't know that. You don't know what you don't know, right? Like you can't just like know about things nobody tells you. So
yeah, a lot of people's, even like in the nursing world, they're like, what's a doula?
Yes, I've gone to so many births where they say, you know, are you the sister or whatnot? And say, oh no, I'm her doula. And then you're what?
I think it's getting better though.
It's so sad to me that you don't know what that is. But I didn't know. So yeah, so and I experienced some birth trauma in my first birth, and that's what led me to decide actually not to be a childbirth educator through Bradley method, and decided that I wanted to find something else, because if I had gone into my birth thinking that I had all of the tools in my pocket that I needed, and then that wasn't true, then I wanted to go get those tools and find out about them so that my students would be more empowered, which then turned into me becoming a doula. And I decided to get the certification because I was like, yeah, I mean, childbirth, that would be a great way to prepare my students, is to become a doula, go to a few births, and then just be a childbirth educator. And I'm mostly a doula, so I do childbirth education, but I definitely focus on my doula work a lot more than my childbirth education work. So. Okay, awesome. So skipping to page 15, I am going to read a quote, and then I'm going to ask you how this quote resonates with you. All I knew was that I left birth feeling exhausted and disempowered, and I started parenthood out that way as well. It's the last sentence of the chapter. Does that feel pretty accurate when you go into leaving your birth feeling disempowered, that then you start your parenthood being disempowered?
Yeah.
Yeah. Yeah. I mean, it completely makes sense. I hadn't thought about it that way before, especially when you're thinking about those incredibly important hormones that need to be released. You're like flooded with oxytocin to get your parenthood started. And when that doesn't happen because you're feeling sad and disempowered, then that is how you're starting your parenting journey.
I was listening to a podcast the other day. It's kind of relevant, and it was the birth hour, and one of the girls who was sharing her story said she felt there could be a connection between how your birth goes and postpartum depression.
Mm-hmm. Oh, there's a huge
mood disorders. She was like, I feel like there's got to be some research out there. And Bryn was like, oh, I'm sure there is. Or it might have been the Built to Birth. I don't know. I listened to so many that I can't keep them straight. But I thought that fits perfectly here, because if you had not such a great birth, then you're going to leave feeling like, oh, that's not how I wanted it to go at all. And then you're on this low, and then you have this baby that you're like, oh, I got to figure out how to take care of this little love child now. And it can become stressful and overwhelming. But if it were the opposite, there'd be more feeling of joy and excitement and fulfillment, I think.
Yeah, there is a part actually in chapter 1 where it talks about the I think it was on page 14, the relation between birth trauma and postpartum depression, and it talks about how
that was where I read it then.
It might be, yeah, because there are really strong links between feeling like even if trauma happens to you in your birth and you end up in a situation that you didn't want to be in, but oh my goodness, but you felt like you were in control the entire time and that you were the one making the decisions. I have to see the baby. Then you're much less likely to absorb that trauma and then have it turn into depression, versus if the decisions you feel out of control, then you're more likely to have depressive episodes as a result of that. And that makes complete sense. Mm-hmm. It's all in a difference of how we're processing what's happening to us. Okay, so chapter 2.
Chapter 2.
All right. I would like to start on page 20. And I put on here that I want to look for personal experience, kind of going over, I put the different practices that she talks about.
Oh, yeah, like the not allowed to drink, eat or drink fluids. Allowed to get out of bed.
Yeah. Yeah. Do you want to start at the start of them and we'll just talk about the concept of evidence-based care?
Sure enough.
Hi, Brittany. Welcome.
Hi. Welcome. Thanks. Sorry I'm late. I've been
You're totally fine. Thank you for
making dinner
coming.
and having me.
Okay, so the first one, we're on page 20, Brittany. Not allowed to eat or drink fluids during labor. Have any of you guys experienced this personally, or have a client been told that they can't eat or drink during labor?
I've had a client told she can't eat. Well, they gave her popsicles. She was in labor for like 36 hours and had no food.
Like Nana has popsicles, you know, Grandma?
Yeah, she does have popsicles, huh?
They're really cool.
Mm-hmm.
When it's hot, they
Mommy's
give it
on a
to me.
call. It's so cool. We'll talk about that later. Yeah, that's pretty common. Yeah.
Mm-hmm.
Yeah, crazy in chapter 3 when she talks about like where that comes from in our history. So frustrating.
I've had so many clients told that they are not allowed to eat or drink, and all that they were given was ice chips.
Same experience, Jamie. Have you experienced this as well? Yeah. Do you feel like it's affected the way that the birth goes, or the trajectory, mindset, energy levels?
Totally.
Yeah.
Totally.
Yeah. I had a client. It was my first client during COVID, where the hospital had allowed us back into their birth space. Hi, Cindy.
Hi, sorry.
Oh, you're totally fine. So I'm in there and they're telling us that she can't have anything to eat or drink. And mom is telling me that she is hungry. And they're like, you can have popsicle, or you can have some applesauce. And she was like, no, I'm hungry. Like it was an induction. She'd been in labor for quite a while at that point. I don't remember exactly how long, but had been quite a bit. And then I convinced her to have some bone broth, and her energy went up, but she wasn't a fan of it. She didn't think it tasted very good, so she didn't want very much. And then when it was time for her to push, and you could just tell her energy was down, she was exhausted, and she was telling me, she said, I'm tired and I'm hungry. And I was like, if someone's pushing and they're telling you that they're hungry, they're hungry. You can imagine wanting to eat and pushing, right? And so her boyfriend leaves over and goes, hey babe, when you're done, let's get this baby out and let's get you a steak. And I was like, yeah. She's moving on. He just kept telling her how that steak was gonna taste. He's like, it's gonna be,
yeah, that's motivating.
Rare. Like, he's describing the steak to her, and I was like, that's adorable. And I'm so sad that it's happening at the same time. You know, it was just like, she should be fed. She should not be hungry while she's pushing. But I mean, you know, I think that it does affect birth spaces. For my home birth, dude, I ate the whole time. Like, I was one of those people that I wanted to eat in active labor. I mean, that's just how I was. And I needed that energy at the end for how long that my labor was. And I wasn't in the hospital long enough for my second, because I had my second in the hospital, for it to come up. But they were telling me that I couldn't eat or drink, and I laughed. And I said, you can say that, but I'm letting you know, full transparency, I'm going to eat if I'm hungry. I ate my whole labor first go around, and I needed that energy. So, but I wasn't there long enough for it to come up. It was a precipitous birth for sure.
It's just so crazy to me that that's still a common practice in some places, because
Most places, I would think.
Yeah. You go a day without eating like a meal or two. Or even, I don't know about anyone else, but if I don't eat, I feel like I'm going to die. Maybe that's a little dramatic, but I have a headache. I'm grouchy. My energy sucks. Like, I'm just a monster.
Experience that hangry.
And really, it like, grab a Snickers, because I turn into a monster, and that's just in a day. I can't imagine like 36, 48 hours or even longer.
While being incredibly active.
Yes.
You're burning calories like crazy, and then you need to put them in.
And then
Yeah.
they're also giving you, like, they could be giving you some meds and
Mhm.
I actually cried in labor when they brought me a great popsicle when I said I was hungry.
Oh my God.
Like started sobbing because they brought me not only a popsicle, but a great popsicle, which is like the one kind I cannot eat. And that's all they would bring me because they were out of every other kind.
Awful, Cindy. I did
Yeah.
not do that. Oh my
Yep.
God.
It was just one of those random memories of labor that, you know, yep. Great popsicle of all the wonderful things to be brought during labor and delivery.
Man, I'm so sorry that happened to you.
You know, it's just one of those things that, especially, it's one of those things that we're working on changing. And that's one of the, you read this book, and so it brings up those memories though. And so you start getting more and more fired up. And every time I read this book, I get angrier and angrier about birth. And I'm like, we've got to change everything again.
Mhm.
So
Yeah. Speaking of everything, the next one, still on page 20, not allowed out of bed during labor. Has anybody experienced this particular one?
I feel like when maybe,
oh yeah.
like my client, when she was put on magnesium, does that sound right?
Possibly. I mean,
So it was for blood pressure. And she couldn't get up and walk around.
were they worried that her blood pressure was going to drop when she stood up?
Maybe. Oh no, but it wasn't until they gave her magnesium.
I
don't know.
It might have been worried about a reaction of the meds causing her to fall, because that could cause some pretty serious problems.
Yeah.
Cindy, you sounded like you've experienced this. Was that something?
I've experienced it.
Personal?
Yeah, I mean, I've experienced it personally. So once you are in the hospital and on an IV, at least when I was in labor with all three of mine, I couldn't get out of the bed. With all three of mine, actually, once my water broke, I couldn't get out of the bed. So with Alex, I got to the hospital when my water had already broken. And so that was it. Couldn't get up.
No.
So, yeah, there was one point, there's a picture of me trying to walk and holding onto a wheelchair, and my little sister is sitting in it. My mom had snuck me out of the bed, and I remember the nurse coming and yelling at us because my mom had me up walking in the hall to try and get labor going, because my labor was not going. I wasn't having any contractions at all after my water had broken.
Yeah.
And so she was doing anything she could my mom had 5 children, and I was the only one out of 5 born in the hospital. She knew what was needing to be done, and they wouldn't let me out of the bed. They weren't, I was on Pitocin, all of that, trying to get things going, and nothing was happening. So my mom's like, we're getting up and moving.
Right. Smart woman.
Yeah. And the nurse had come back and was like, no, she has to be laying down. This is a liability. What if something happens?
This is a liability. Yeah. Yeah. My water broke in my home birth 33 hours before I actually gave birth. And sometimes that happens. I mean, prom labors, premature rupture of membranes. It happens. It's not super uncommon. For my older sister, she had prom birth for her second, and it took 40 something hours for her labor to start after her water broke. It's different when you're at home in your own, bacteria and whatever. As clean as they try to keep hospitals, it's a completely different risk set. That is something that is different, but it's crazy.
And mine had the difference of being, he was extremely early too. We were about 8 weeks early.
Oh.
But we were 8 early. So, there were some additional risk factors there too. So it wasn't like it was just
a prom birth. Yeah.
Just a prom birth. There were other things going on there, but just, if I had known more, had I been a little bit more aware of what was going on, I probably would have done a lot of things different myself.
Yeah.
Probably things that might have prevented the prompt to begin with, or would have handled that whole situation right from the beginning differently. So you live and you learn.
Yeah.
You do better, know better. So
yeah,
know better, do better.
In chapter 1, the importance of education before you go into labor.
Yes.
Astronomical. Yeah. So I actually haven't had a client experience this, and I didn't experience it myself. But before I was a doula, my older sister had her first baby in a hospital, and they would not let her out of bed. And she wanted to go without pain meds. So she did a lot of labor on the bed, but on her hands and knees. And they were not a fan, but she wasn't breaking the rules, so they couldn't really say anything about it. And so they would come in and she would lay down for them, and then they would leave, and she would just get right back on her hands and knees. And then they'd come in and say, "You move the monitors," and we were like, "Oops." And she'd just get right back. I mean, laboring on your back is the most painful way to do it. So, I mean, the second that they left, she was just always right back on her hands and knees. And it was crazy to me that she couldn't get down. I mean, I knew nothing about birth at that time. Besides, I grew up with my best friend's mom being a midwife, and she would talk to me about stuff. So in my head, I was knowing that like this was wrong. This sounded nothing like what I was experiencing was nothing like what my friend's mom, her name was Linda, had been telling me. And I was just, the only thing that I could think of is it has to be so different when you're doing it at home. And after my home birth, where it didn't go quite as straightforward as I wanted it to with my midwife, I'm now kind of seeing that it's not necessarily where you do it as far as the culture of where you do it, if that makes sense. Okay, let's see. What's the next one? Page 21, intravenous fluids during labor. I don't think any active doula has not experienced a client with fluids in their arm. Anybody here not experienced that? Yeah, it's so common practice.
So you said opposite.
Right.
But with my second, I had a hospital birth and I refused the IV.
Oh yeah, I mean, I refused the IV at my home birth, my hospital birth, home birth. Anyway, yeah, I mean, there are hospital labors you go to where this doesn't happen, but I don't think any doula that serves in the hospital for, you know, any decent length of time will not experience a client having an IV. It's just so incredibly common practice. And just so not evidence-based. You just quite simply do not need it as long as you are allowing your patients to drink when they're thirsty.
Yeah, usually they have the IV before I even get there.
Mm-hmm. Yep. And I've had clients that say, no, thank you. And, you know, they will just not do a HEP block at all, which is totally your right. You know, the number one reason that they give you for needing that HEP block, in my experience, has been they say, you know, you might hemorrhage and then you'll need Pitocin. You can get a shot of Pitocin in your leg. You don't have to get it intravenously. And, you know, the book kind of talks about how it's not necessary and it can cause problems with the swelling in your hands and feet and causing baby to have excess fluids in them as well, which is really interesting. Then babies get a higher birth weight than what they actually are because they're full of all of these extra fluids. And then, you know, I was actually reading a really great study on how birth weights for people who have IVs should actually be taken at 24 hours, not immediately. Because then you're weighing them, right? And you're saying, what's their weight loss? And then they're saying, oh, they've lost too much weight because you're taking this weight that was actually not their weight. And then they're saying, oh, it's so great that you tried breastfeeding, but clearly you're either needing help or whatever. And so then we start on the formula, or we start panicking moms and making them giving them an oversupply when baby was actually not that weight to begin with.
Yeah, and the extra fluids can also distort the shape of the breast, making it harder for baby to latch as well.
Yep.
It sabotages breastfeeding quite a bit.
Yeah, it does. It's a good point. Thanks, Jamie. Yeah, that all of these things. Does anybody else have anything to add about IV fluids?
I will just say, I think St. Luke's East has done a pretty good, at least my experience there. They do a really good job of like, one of my clients, they did give her an IV, but hadn't hooked her up to anything. And then they just encouraged her to keep drinking fluids because she didn't want the fluids, but ended up getting fluids because she wasn't drinking enough. But I felt like that was really cool to see, because a lot of times it's just, like you said, the routine, and they do this. This is just what they do. This is the game plan. They come in every day. They do the same thing. They go home, come back and do it again the next day, you know? But I thought that was really neat to see.
Yeah, that's awesome.
And it's usually non-negotiable for the patient too.
Right.
They're
That's a big part of it as
listed
well.
as combative if they decline.
Yeah, that's really frustrating.
She doesn't want an IV, so she's difficult.
Yeah, hate that label. All right, next is continuous fetal monitoring. Yeah, I mean, it's much more common for me to go to a birth where there's continuous fetal monitoring than not. And there's so many. I remember when I was taking my childbirth education class, and I had been studying before I started when I was pregnant with Emily, my first. And it was my first time taking a childbirth education class, but just having the best friend as a midwife, and then growing, like, just reading because I was bored and that's what I do. And I had read so many bad things about continuous fetal monitoring when it came to the studies. And then they started talking about it and I was shocked. I said, what? They still do that? And my teacher was like, yes, like it's very common. I was like, why? She just stared at me and said, like, there's so many studies that show how bad it is. Like the readings are inaccurate, and then it causes like unnecessary C-sections, and that like it's extremely uncomfortable, and then it restricts movement. Like, who would still do that? And she was just like, everyone. And I'm in the birth room. I'm like, so naive. So idealistic of when something's been shown to be bad for you that they'll just stop doing it. That would be great. I am excited to hear about the Bluetooth option that Brittany was sending to everybody, that continual fetal monitoring via Bluetooth, so you don't have those lines. Interested to see the reporting on accuracy for that, as they've used it for a while, hoping that it's closer to a Doppler, which would be awesome.
It looked like it was supposed to be pretty accurate.
Great.
And it allowed her to move. She could get in the water. Because I asked if she wants a shower, can she get in there? And they were like, yeah. I am confused as to why they didn't just bring that out to begin with, but maybe they have to buy a new one for parent. I don't know. I don't know the specifics on it. I don't know what the cost is. If it's just, maybe just a part of it has to be replaced, like the pads or something. But it was awesome. It was so cool.
That's
I was very surprised to see it at that particular hospital too. But
yeah. All right. Does anybody have anything else they want to add about continuous fetal monitoring? Very cool. As I'm just like scanning this, I'm just looking at the her talking about the continuous fetal monitoring, and I'm like, why? Okay, Pitocin to speed up labor, also called Pitocin augmentation. Has anybody here experienced Pitocin themselves? I mean, Cindy did, but she logged off, so.
Yes.
You had Pitocin, Brittany?
My first.
Oh,
I
yeah,
did.
that's right. I knew that. I'm sorry.
That's okay. Yeah, I had it with my first. Sorry.
So
no more
did your labor start spontaneously and they were just trying to speed it up?
It did. So my water had broken, and typical first time mom. I was a week early, and I got there. I wasn't making very good progress. It was 6 hours in, and they're like, well, at about probably 5 hours, they were going, yeah, here you go, potato. They were going, you're not making fast enough progress. You get infection, and if things get worse, they insinuated that me and my baby could die. Basically, they put that fear in there. I didn't know any better. I didn't know any different. So I'm thinking, okay, I guess I have to do this. It was only 6 hours in. I was only a few centimeters. I don't remember how far, but I know I wasn't making very strong contractions at that point. Oh,
They were trying to speed it up.
Yeah, they were trying to speed it up. I'd never want to again. Yeah.
Were you able to walk around?
Yes. I had the pole, and with the pole, I was able to walk the floor, surprisingly enough, which is very uncommon that they would unhook you. They still did the intermittent monitoring. Again, very uncommon. But I got farther into the labor. I still wasn't making fast enough progress, and they were threatening me to increase the dosage. And of course, every time the nurse came in, do you want an epidural? Do you want an epidural? No, I said no, I don't want an epidural. So that was fun.
Man, I'm sorry that they were pressuring you. I hate that. We talk about that. That's one of my things that I talk about in chapter 3, where she talks about being able to labor free from pressure and coercion, just being such a goal to have, that really should be a basic expectation.
Mm-hmm.
Okay. All right. What is the next one? Frequent vaginal exams. Does someone want to take that? I'm going to be right back.
So I've had both ways. Some hospitals seem to come in and do a vaginal exam every hour, and others are like, oh, no, we're fine. We don't need to do one right now. And it's been like 2 or 3 hours. I'm like, okay, I'm fine with this. Now mom's starting to ask. And then they'll do the vaginal exam. Mm-hmm. But it's always interesting and kind of nerve-wracking when they don't do it because it's not the norm.
All right, apparently Cindy logged off because she decided to drop by my house, so she's here now. Impromptu showed up as I had to mute because my dog was barking, and I had no idea, so it's pretty funny.
Just stop my camera.
Yeah, oh, you did? I'm not checking my phone. My door opened, and I was like, well, hopefully that's someone I know. My dog seems happy about it, so Cindy walk up the steps. That's so funny. It was pretty funny. Okay, so page 25, epidural for managing discomfort. I actually was a doula for a while before I experienced a birth with an epidural, and my very first one was unsuccessful, and it was like being thrown into the fire. It was so, oh my goodness gracious. I had been to several births at that point where there's just a management of pain because you're in charge of it, you're moving, there's counter pressure, you're listening to your body. And then there was a failed epidural that only worked on one side and she could not move. And she was in so much pain. And there was just, I did counter pressure until it just, my hands gave out. They started cramping. This is 12 hours straight. Has anybody else experienced failed epidurals?
The very last birth I was just at was a total fail epidural. I've had the majority of the ones I've been to work pretty well for the most part. Guys, that's not mommy. I'm mommy. But this last one, she had made the decision to get the epidural, and once they make that decision, it's like I need it and I need it now, and I can't do this without it. And then when that epidural doesn't work, she had a panic attack as she was pushing when having her baby. And she's just screaming and like, oh my goodness. But it's not always a good thing to have that epidural because, they are expecting it to work. And if it's not working, right? Stop. And then when it doesn't work, it's really not. Oh, okay, I do have to go this way. Oh, it's flipping now.
Oh man, it's gonna give me motion sickness.
I'm sorry. It flipped over earlier and I was trying to fix it, but it's she was so close to being there too, and it's just when they choose to get that epidural, they're almost there, and then it doesn't work. It's so much more detrimental to them, I think, that they're expecting this relief, and then they don't get that relief.
Yeah, failed epidurals are an animal of their own. Yeah, that's, and then anytime that somebody has an epidural, sometimes they're great that they give mom a nap, or maybe she's just like really not relaxing her pelvis, something along those lines. It is crazy, some of the potential side effects that she talks about, like your drop in blood pressure, drop of baby's heart rate, problems passing urine, fever. I've known some people that it has caused them to pass out, just a reaction to the pain meds. And something she doesn't mention in here, but I hear about a lot as a doula, is continuous back pain at the site of insertion.
And by continuous, it's continuous.
Yes, Cindy said by continuous, she means like it's continuous. It's just constant lower back pain for years and years. I get that a lot. The other clients that have decided to get an epidural.
I've had clients feel like they are freezing, absolutely freezing, and it continues even until after the baby arrives. They're freezing, or they're so hot, or they're really itchy. They're just itchy everywhere, all over their entire body.
Oh my gosh, yes, the itchy. Oh yes, or they feel like they're itchy and they feel tingly and almost like bugs.
No bugs, please. No, thank you.
I personally have never had an epidural. I have had clients that have had epidurals, and I get all of these things pretty often. Yeah,
I've heard the cold, like the shivering, like uncontrollably, like shivering.
Yeah.
But I haven't heard of I've heard of the itching, but like it does make sense that it would feel like bugs. It's almost like they have an adverse reaction.
Yeah, that their body just kind of rejects it.
Yeah.
Yeah, it's very, most of the epidurals, honestly, for most of the births that I've gone to where they have an epidural, it ends up being with spots where there's just some nerves can feel more often than not. That's what ends up, and then, I'll be there to kind of nurse that one spot that tends to grow. It's crazy. As much as you try to get the medicine to go to that spot, it tends to, that once they start, that spot's going to grow. That's been my experience. But then, you have all of these other side effects. And I'll have clients who had epidurals previously, and they'll say, absolutely not with this one. I had a failed epidural, or I still have back pain, and they are quite frankly not interested, and that's their line that they will not have. So it is like, it increases the force at birth, just all of these things not being evidence-based. Does anybody else have anything that they want to add? I believe that is the last one. Is that the last one? Oh,
Oh, there's a lot more.
there's a lot more. I thought that was the last one. I have it on.
Oh,
And-
yeah. There's
Makes it a little different. Continuous labor support on page 27.
Yeah.
Labor support is defined as the therapeutic presence of another person. It includes physical support, emotional support, information, and advocacy. I thought that it was very interesting that, according to this, most nurses have no training on hands-on labor support skills, and that it's not taught in most nursing schools or hospital orientations for new nurses. I thought that was crazy.
If we come across nurses who are really good at hands-on care, it's probably because they did their research for maybe their births, or are just really interested in providing that type of care for their patients.
Yeah, I've worked with some really awesome hands-on nurses that you can tell they had fantastic training. And I've had some that, nope. I'm really happy to say, though, for my personal experience, when I got a newer nurse, that's when I tend to get the nurses that had really good training. So I'm wondering how much culture in hospitals is shifting toward that. And I'm really hoping that that's the case. I think that as more work like this comes out, more people are becoming aware. It's starting to become something that people are calling for, and demand is working. That's been my experience. I've actually had nurses ask me how to enroll in spinning babies. Isn't that fantastic? Yeah. Yeah, so that's something that, man, but then you have these they're incredible nurses, but they don't have the time. Also Rebecca Dekker, but I learned from her that nurses only spend an average of 6% of a labor in a birth space, which is just not continuous support. So as much as they would love to, and they might be fantastic nurses, they quite simply can't be there for the entire time, like a support person such as a doula would. And I think that's surprising to a lot of people in their first births. Does anybody have anything they want to add about continuous labor support? Every birth that I've been to has had continuous labor support because I am there.
Because of you.
That is my 100%, every single one. So.
Oh, that's funny.
Okay, so the next one is water immersion during birth. Water births, yes.
I'll never forget when I was watching a video on Instagram of a mom giving birth in a bathtub, and the husband, like, as baby was being born, was like, "Oh my gosh, is it gonna be okay? Like, can it be in the water?" And she was like, "Yeah, the baby's been living in water for 9 months.
Right.
And I was like, and there's the epiphany, right? Like,
That's
we
right.
like, wow, my mind is blown.
Right.
Wow,
Yes.
this baby's been living in water for 9 months. I had no idea.
Right. Well, I mean, did they think that you were breathing air inside of mom?
So
No.
I always keep that like in the back of my mind, because I think that could easily be a quote to pull out as a tool of reference at some point.
Mhm.
Along
Oh,
the
yeah.
lines
I'll
for
say
a
that
partner or a
for
mom
the
or anything, because wow.
Yeah, when my sister had her first home birth, and she's had all of her babies except her first one at home in water. And when she pushed out my nephew's head, she actually got very distressed because it hadn't occurred to her yet until she actually felt his face underwater. And she started to stand up. And the midwife was just like, don't stand up, honey. Once you stand up, then you got to stay that way, because once baby's head is out of the water, it has to stay out of the water. But well, if he hasn't taken his first breath yet, if he's in the water, then we're okay. And she kind of, because obviously she didn't sit down and give her a full explanation. But then my sister was just like, yeah, no, and pushed before she had a contraction because she was uncomfortable with the idea. She just wanted to get baby out. But with all of her other ones after that, it was, and with Emily, actually, because she was born early and at home, my midwife wanted me to keep her underwater for a little bit because it was warm. And so she was assuming that she was going to possibly have difficulty regulating her body temperature. And that was like her step one of figuring out. So Emily actually stayed under the water for probably 30 seconds or so, if I'm remembering correctly. Sometimes we don't remember our births 100% the way that they actually happened. Our brains rewrite them.
Close enough.
And Jamie, you had a water birth.
Yeah, I did. With Maria, she was born in the water, and me and Jonquil got to lift her up out of the water together, and that was great. With
my tears. So sweet.
I have it on video.
Oh, how special. That's even better.
No, we want to see that video, right? If you're willing.
Right. Oh, it was funny because we had bought like a brand new camcorder and had like set it up to record the birth, and Jonquil was struggling with it the whole time, and he didn't figure out how to actually get it started until about like 10 minutes before she was born. So we got that like last 10 minutes of labor and her birth. So it was like perfect timing.
Yeah, got the important stuff right there. Oh my gosh.
That's so neat though. What a great memory.
Yeah.
And then you can embarrass her later when she's grown. If you so desire. If not, that's okay.
Every year on her birthday, we should get out the video
and show it
for everyone.
Yeah. I mean, yeah, this could be an annual tradition. I'm down. I can add your birth video to my childbirth education class. Share with everyone. Anyway.
Be a celebrity.
Okay, pushing positions, page 29. One of the least effective pushing positions is lying on your back or semi-sitting. Why? The least. It's very frustrating. This makes the sacrum or tailbone inflexible, which makes it harder for your baby to exit your body, especially with gravity working against you both. Great. So basically being in squatting, hands and knees, standing or kneeling, you're much more likely to require assistance and you're more likely to have a shorter pushing phase. In my childbirth education training, I was taught that squatting actually makes your vaginal canal shorter and fatter. So that is, if you can get into some sort of a squat, that's going to give baby more room and make it where there's less space that it has to move. Most of the natural home births that I have attended end up in a squat when they actually push. That's actually how you can tell that they're about to push, is they rock into a squat. And I know not everybody does. That's just the ones that I've attended. Almost all end up in a squat. I know I tried to squat. For my first one, I was way too tired. I had been in labor for so long. So I ended up giving in a reclined squat. My husband held me up.
Yeah, that's what my mom ended up in with almost all of them, with my dad holding her.
Reclined squat. Yeah. Yep. And at the hospital, it was get on a bed on your back. So.
Yeah. Mine was like a hair
For 2 of my babies, I was on my knees.
Oh yeah, you did hands and knees, or just knees?
Yeah, I was knees and leaning on a ball for Abigail in the hospital with my midwife, and at home for Gerard, I was on my knees in the birth tub. Yeah, but that's always the most comfortable position for me, is each time. My first with Gwendolyn, I was on my back, and she's the one I tore with, whereas my 2 biggest babies, I didn't tear at all.
Oh,
Interesting.
nice. I've never torn. Did you?
It's not.
I had an episiotomy.
Cindy had an episiotomy.
Or Andy. I had
So
no idea I was
2 of
getting
them?
one until afterwards.
Oh, non-consented episiotomies. Have you torn, Jamie?
With Michael, I had like an abrasion, but I didn't tear at all with Marie.
That's great.
That is great. Yeah, they find that with more mother-led pushing and, being in water, things like that, you're a lot less likely to tear. And when you do, there's a lot less tearing. And episiotomies tend to tear you more.
I'm curious because you all have a lot more experience than me, and I've been in a lot more hospitals than I have. What's your experience with pushing positions in hospitals with your clients, like within the last year or so?
Not great. I had one birth in particular that always comes up in my brain anytime that I'm reading anything about pushing positions, where baby was turtling, coming out, going back in, coming out, going back in. And I was trying to convince the medical staff to let her change positions because she had an epidural, and so she was on her back. And I said, well, we can get her, you can push with a peanut ball. And she had enough feeling in her legs, so we could have gotten her on her hands and knees, would just put a small exercise ball under her belly to support her. There were different things that we could do to get that leg up. Gail Gines talks about doing the flip-flop whenever you start having a baby that's turtling, and they wouldn't do it. So that was very frustrating for me. She was game to try, but they were not. So that was very frustrating for me, to have that knowledge and to know that there were the options weren't exhausted, So that was, I haven't been to a hospital birth where they were open to trying different pushing positions. They have all wanted it to be on your back.
It's more controlled
with the stirrups.
So in this last birth, even though she had the epidural, which failed, the practitioner was totally open to her being on her hands and knees.
Oh, great.
She ended up having to flip her because she was fighting it so much. But yeah, she was like, yeah, you can be wherever she wants. I was really impressed. I was really
That's
surprised.
awesome.
And, yeah, because she had such a hard time managing her labor. No, that's a cover up. Managing her labor when she was lying on her back.
Mm-hmm.
So every time I get her up, standing or leaning over, she was doing so much better. And the doctor was totally fine with her being on her knees. until she started
Nice.
pushing.
And I know that that's other people's experiences. You know, just speaking from my own personal experience, I haven't had that, but I know, and I've heard of other practitioners that are perfectly happy to meet you where you're at. You know, just learning hospital policy for where you're planning on giving birth, talking to your doctors about it, where they've had actual experiences of people pushing in other positions besides just on their back is, you know, going to make a huge difference. You know, there are people that are willing to work with you. Just finding those people is really important. You know, something that she talks about, you know, just the empowerment of finding somebody who's going to support you so that you don't have to fight during your labor. Giving me time to push. What's the longest pushing period that you guys have attended?
Mine was 2 hours of what I've attended, not personal pushing.
The longest that I have personally attended was merging on 3.5.
I think mine was like 2.5, maybe.
Yeah. Normally for my personal experience, when I've attended unmedicated labors, the pushing tends to be much shorter. I found that for a lot of the epidural births that I attend, they have to do practice pushing to start with, which really extends the time that they're pushing because they can't feel those muscles. So the nurse will reach in and actually push the muscles that they need to activate. And I found that just figuring out how to push muscles that you can't really feel takes a while. And then during all of that time, you are pushing. So I think that might be one of the reasons that the pushing phase is just longer with epidural births. But I know that the average in the United States for a first-time mom pushing is 2 hours. And I know that there are longer for unmedicated as well, you know, just depending on baby's position. But you know, letting somebody push for an extended period of time if they're willing and able, I think is good. And, you know, she's talking about in here that as long as you're making progress with each push, that, you know, you should be allowed. The difference between, I did use this term earlier without explaining it, turtling, baby coming out and then going back in, coming out and going back in, is that baby's going back in, which they're always, you know, come out a little bit and they go up a little bit, but they need to be coming out more than they're going back in. In turtling, they're not. They're going back in as much as they're coming out. So no progress is being made. And that generally means that baby is some kind of stuck. You know, that's where you're starting to get into wanting to move the pelvis out of baby's way, essentially, which is why you're doing the changes of positions. So I think that combining allowing somebody to push for longer with changing of positions is incredibly powerful for successful vaginal births.
That makes so much sense.
Just do it.
Oh, no.
Oh, we lost Brittany. Okay, early cord clamping. So the research is in, and early cord clamping is low on that scale of evidence-based birth. So whenever I'm talking to my clients about cord clamping, I always explain to them that baby's blood is still inside the placenta, and it's like on average 1/3, I think, of their blood.
Crazy.
Isn't that crazy? And so then just like letting it get white 60 seconds or more before clamping it. But then sometimes people want to donate the cord blood. And so they actually want to clamp it quickly so that they can then donate that blood. So multiple options, but evidence does show that it's better for baby to get that blood. So have you guys experienced early cord clamping with your clients or with yourselves?
I mean, with my kids, definitely. That wasn't even a thought in our minds back then.
Yeah, Cindy said that she did not know that that was a thing. So
they were just starting to come out with the idea of donating or saving your child's cord blood.
Oh, really?
To use later on in life, or stem cell research, and these ideas of banking cord blood was just starting to come out when I was having my children. So, I mean, when I had Alex, that wasn't even like a thing. So these ideas of waiting to like, that was something hippies did, and like,
yeah,
the people who like,
nobody did a lotus birth. Exactly.
Right. Maybe those people in the 70s.
Yeah.
But who knows what they were doing with that. Yeah, I mean,
so I actually,
we were like reading, what to expect when you were expecting was like the book to read, and yeah, like I didn't know anything better.
Right.
So
only know what you know.
Right.
I actually have had all of my clients delay cord clamp. I only have had one client who didn't, and that's because her wishes weren't respected during an emergency C-section. So, but all of my other clients have decided to wait. We knew enough in Chelsea's work. We didn't know a ton, but we knew to delay the cord clamping. But it is something that comes up pretty often. I don't know if it would make a visible difference, but I know that, there's a lot of research talking about the blood flow. 30% of baby's blood volume is left behind in the placenta, and the baby only receives 70% of their own blood at birth, according to evidence-based birth. I highlighted on page 31, randomized trials have found that babies whose cords are unclamped for longer periods of time have higher hemoglobin levels in the first year of life. And then they looked at brain scans of infants who were randomly assigned to early or delayed cord clamping at birth and found increased brain development around babies who received delayed cord clamping. And that makes sense. You've got higher iron, more hemoglobin, you're going to have, your baby's body is just going to work better. Okay, page 32. Separation from my baby. It's a sad one. So I had one client, my very first client, when we were no longer allowed in hospitals. And she had a C-section where she went in just for an appointment, passed out during her appointment. They were giving her some iron. It was so crazy. I had been in a video chat with her before she went, and she was totally fine. Lots of energy. She was doing her hair while she was talking to me. We were talking about the appointment, what was going to happen while she was there. And then she went to her appointment. They gave her some iron. Her body rejected it. She passed out. And they did an emergency C-section on her while she was unconscious, and then separated her from the baby. So she woke up, she'd had a C-section, she was by herself, and there was no baby. And she had so much from that. I got a call from her boyfriend. He was sitting in the parking lot the entire time, just wondering what was going on. Nobody called him until the baby was an hour old. When he came in, she had already woken up And so he called me when they finally told him what was going on. And he was just like, what do I do? I have no idea what's happening. And it's okay, well, I don't have the information either. I'm learning from you as we're going. I said, okay, we're going to breathe. We're going to figure this out. You know, and then meeting with them afterward, there was just so much to unpack, so much disassociation, where when they brought her the baby, she just wasn't even sure if the baby was hers. You know, she felt still pregnant. So she said it was like looking at somebody else's baby. And I know that that's a lot more than just separation from baby, but that really struck me when she was saying, you know, when they finally did bring my baby in and I was seeing my baby for the first time. That happened to you with your child too. So Cindy was saying that that happened with her first baby, where they separated her from, and yours was a C-section as well. And it's just like the disassociation that she had, where she just felt like that was somebody else's child, was crazy to me. Crazy to anybody. I mean,
It took a little while.
Yeah, it delays. I mean, we're not, obviously, your baby is a person and your bond, your relationships with people form at their own rates, but you know, having a delay in that bonding is really sad, and it can affect you, especially in like your breastfeeding relationship and whatnot. Have you guys experienced something like this? Yeah, a lot of my clients request that babies not leave the room. They just want to know exactly what's happening at all times with their babies. So that's the only separation of baby that I know of that I have experienced as a doula, and I wasn't separated from my kids. So, but the effects of it were astounding, really. It was really sad. I highlighted separating mothers from newborn babies is extremely harmful. It's a practice that is unique to the 20th and 21st centuries and is a complete break from human history. Evidence shows that the best care for mothers and babies is to provide them with uninterrupted skin-to-skin contact during the first hour or two of life, and to intermittently continue that skin-to-skin contact over the next few days and weeks. This is also known as kangaroo care. As a side note, placing the baby on top of mother's gown or on top of a towel does not count as skin to skin. It is the actual skin contact that allows hormones between the mom and baby to communicate with each other. It is amazing how often people will say that they're gonna allow skin to skin, and then they don't pull mom's gown down and put baby on top of it. Like, okay, let's think about this. Skin. It's kind of in the name. They just on top of gowns.
Nope. Rocket science, people.
So close. We're so close. We're almost there. But no, not quite. A for effort. Babies who are held skin to skin with their mothers have lower stress levels, better success with breastfeeding, and more stable blood sugar, breathing, heart rate, and oxygen levels. So it's worth getting it right. It's pretty easy to pull mom's hospital gown down. Just like when head comes up, I just kind of like, hey, we're going to probably, if you're, and we talked beforehand, we're comfortable with this. We're going to just get that down for some skin to skin so we don't have to move it after you've already pushed out a baby. Okay. There, that was all of them.
Yay! The last one. Good job.
Good job, everybody. So on page 34, she talks about feeling betrayed after she had done research on what is actually evidence-based. And I felt that. It really spoke to me, especially for, you know, my sister's experience. She was always very medically minded. She was a phlebotomist when she had her first baby. And so to be so mistreated at a hospital, and then the more that she learned about it, the more, I mean, even still today, she'll tell me, she'll go back and read something or have a memory and get even more angry, and just feeling betrayed at the loyalty that she had to the medical system that just ended up treating her so badly. And I feel that way. I get angrier and angrier about my birth because, I mean, I did research and, you know, expected to be well taken care of because I was at home with a home, you know, handpicked midwife. And that just didn't end up being the case. That quote resonated with me quite a bit. Did it invoke feelings for y'all? Cindy's nodding yes.
Mm-hmm.
All right.
Oh, sorry. I was just gonna say, it just makes it so like education is just so important on all avenues to educate yourself, whether you want to have a hospital birth or not, and like what you want and what you don't want. It's just so important that we teach people to educate themselves and provide them the direction they need and the resources they need that are good, because there's so much misinformation out there, right? But there's really good information too. So just teaching those like others how to navigate and research.
Yeah, you know, what is evidence-based and what is just tradition, you know, which we're going to talk about in chapter 3. Chapter 3 is infuriating. Chapter 3 is a hard chapter to get through. How did you guys do?
There were many points where I was reading like, it was like 2 weekends ago, and my jaw like dropped. I can't remember at what point. There was one piece of evidence that just made me go, like, what? Because it was just astounding.
Was this new information for anybody? For me, I actually knew all of it before, but it was still infuriating. It was, yeah, Cindy says she gets angry when she reads this book.
Highlight sleep, which I remember, I think, hearing about in the Business of Being Born. But
yeah, they do talk about it.
Reading about it in so much more detail, I was like, what? How was this even legal?
Yeah. Yeah. When I was studying the history of birth, I was reading accounts about twilight birth. So way back, 5 years ago, I remember reading about it and just being like, ugh, that's so awful. But then you also kind of think, well, that was then, and we have such better, I don't know what it is that we always just, my tendency is to go, well, we know better now, but do we?
Man,
yeah, as Cindy said, we thought we knew better then. Yep. That is, yep. So how, because I'm looking at, in chapter 3, she starts talking about her next pregnancy, and, Jamie was talking about how she immediately, she had Michael and she was writing her next birth plan. So how did your planning for a second or third birth change from your first, or how have your clients, if you're serving them for their second or third, fourth, fifth, sixth birth, 20th, they'll talk about why they changed what they did. Did you personally change that a lot? Do you serve a lot of people who have changed their birth plans?
Jamie,
you're muted.
Yeah. The people that I have served, I think a lot of them, whenever they're on their second or their third babies, they didn't really have much of a birth plan with their first, and it just without a birth plan, things didn't go as they expected, and they want to be more intentional the next time around. They have a much better idea of what could happen and what they don't want to happen.
I feel like most of the clients I'm serving are first-time moms, but we did just have, Jamie and I had a mama give birth, and she wanted her first birth. She ended up with an epidural. And she wanted to try for not having an epidural this go around. She wanted to try and go all natural. She did great. She didn't end up with an epidural. She did have to be induced, unfortunately. But she was a rock star. She was a champion. So It's cool to see though the younger generation learning and growing, because the younger moms I'm serving, they seem to be much more aware that what is considered standard practice isn't necessarily evidence-based. And so they're doing their research and they're making their birth plans, and they're like, yeah, I want support in this, which I think is really, really cool. Even like these young moms, they haven't had a baby yet, and they're still like, they're doing their research. So I think it's really neat to see that. But I haven't been on enough birth teams to really gather evidence, but it would be cool to see the correlation between how successful they are, like in the birth space and the planning that they did. Like, how do moms become more empowered from the first birth to the second birth to the third birth? Does that make sense? Because
Yeah.
even though like they're like making so many plans and like researching, when they get into that space, sometimes you just become so vulnerable and subject to the norm.
Mm-hmm.
It'd be interesting to see like the research and the data. Sorry, I'm like nerding out right now of like,
No, that's what
I'm gonna
evidence
collect
is.
my data.
Evidence-based birth is. It's the research and the data.
Like, it'd be really neat to see like the statistics there.
Mm-hmm. Yeah, what I find, there is data behind, what we were kind of talking about in chapter 1, is the ownership of what's happening to you versus having things just happen. And I think that when there's planning involved, when you have, what's your options are, and have decided what is important to you beforehand with the making of a birth plan, then you are more likely to, even if things don't go your way, and you are, there's different things that happen that weren't on your birth plan, but because you were involved in the decision making of it, and hopefully that continues into your birth with the support from your birth team, that then you're less likely to have trauma afterward, which is, to me, a heartening statistic, because we know we have something that we can do to make these outcomes better.
Right.
Mm-hmm. For me personally, funny enough, because my first birth was a home birth, I actually didn't change my birth plan very much at all.
It's a different midwife.
Different midwife. Yeah. I went from having a home birth midwife to a hospital midwife, but the plan itself that I gave her was almost exactly the same. The only difference that I changed my mind on is that I wanted Ben to have vitamin K because I was going to circumcise. Mm-hmm. So Emily didn't get vitamin K and Ben did, but other than that, it's pretty much the same. So.
Hi, beautiful.
She just wants to come pop in, eat some peppers every once in a while.
I love
it. It was
it.
my own fault for putting it right next to myself.
I like her. I like hearing her crunches.
Sorry.
I've got short hair.
You do have short hair. Yeah.
I cut it at my grandma's a really long time ago. I was at my grandma's today.
Yep. Thank you, sweetie. We'll love to hear that story another time. Okay, so when she talks about wanting to be free from coercion and pressure, it struck me how important yet rarely discussed this is. How do you help your clients not have to fight in labor? Do you have like a specific thing that you do? Do you have like a specific way that you kind of handle it? Or do you think that that's not really necessarily in your scope?
I wish it was better in my scope. Like, the advocacy cards help so much.
Good.
Clients to put the phrases somewhere where they see them all the time. And so I'm like, either a bathroom mirror on the refrigerator, and every time you see it, I want you to practice saying a new phrase. And so that way they're becoming familiar, so that hopefully when they're in a situation, they can pull one of those sentence, like the sentence starters out, or like become so familiar with the phrase that it just comes naturally to them. But I wish I was better at this. But what makes me even more mad is when our client, like my clients, take in their birth plan and the doctors just kind of like scoff at it. They're just kind of like, ugh, you don't really know what you're talking about. And that's what makes me really upset, because then that kind of gives the message of like, they're going to have to fight during labor. They're going to have to advocate for themselves, when really their only job should be to breathe.
Right. Or they could switch practitioners.
Yes, or they could switch.
Mm-hmm. Yeah, and Standing Strong, the advocacy class that I teach, it's like step-by-step instructions on how to change a practitioner.
Go and fill out a request for
How do you, if you literally are in labor and you suddenly realize that you don't want the specific person in your room, how do you get rid of them? And I literally even write the phrases.
thing. Can you do that?
Say this, call this, say this. And then Cindy was, I'm going to sit down and write what she was talking about into it. But she was talking about like how the hospital has to respect your wishes. And the ramifications if they don't. And it was really cool. Just the, because people a lot of times when you've gotten to that situation, a lot of your power has been taken away. And just knowing that punch behind your rights is awesome. So I'm excited to learn more about that. I'm definitely going to be doing more research. My Standing Strong class is going to end up being like 5 hours long, y'all. Every single time I teach it, I'm like, oh, and this.
We're going to need like a whole workshop weekend. It's going to have to turn into like a
plan. We are. Funny you should say that.
So cool.
Too. Anyway, not yet. In the future. Not today, but in the future. We will. It's going to be great. So before reading this, did you know the history of birth in the US? And did you learn anything new? So we kind of already talked about this, but kind of getting back to it, was this their first time being exposed to the history of birth? I'm talking about like midwives and stuff too.
I found it really interesting to learn about the midwives and how essentially like the white people completely eliminated the Black midwives. And that really hurt my heart, and how like we can learn so much from them and yet we completely ostracized them, which made me really sad. And like, while there are Black midwives out there and we can still continue to learn from them, like the grand midwives and all their knowledge and expertise that could have been passed down, we completely missed out on. Like, I kind of feel robbed.
Yeah. Absolutely. Yeah.
Kind of. I do feel robbed.
So many things.
It's like, dang, we could be so much farther if we want to ostracized
and straight up kicked out.
Yeah.
Just
so
threw out, which is just
with no regard to their knowledge, their expertise, their experience. It's just sad, man. It's just super sad. And like I knew about it, but I didn't know as much.
Yeah. This is something that I have a history degree. I was bored. I was pregnant with my first baby. I had just dropped out of grad school. 1 second. Because I'm a nerd, and I was actually reading manuals for some of the original male OBs for how to go into a birth space without scaring a woman, because they weren't expecting a man to come into the room. And
was it comical?
Oh my gosh, well, they were having this phenomenon where women were freaking out when men were coming into their birth spaces and sucking the baby back in. Because that's what you do when you freak out during birth. You get scared and your body says, oh, a predator is nearby, it's not safe to give birth, and they suck the baby back in. A lot of mammals do that. And step-by-step manual on talk outside the door where they can hear that there is a man. Open the door a little bit, slowly come in, but stay in the corner, and like how to slowly get there. Exactly how to lift her skirts up in a way that was preserving her modesty as much. I'm like, how do you preserve somebody's modesty while they're like, okay. All right. So yeah, I mean, from one point it was comical, but at the same time I was like, this is ridiculous. Why are you doing this? Get out.
Yeah.
she literally, does so much does not want you there that she is willing to suck up her own baby to get you out of the space. You're not welcome. Get out. But yeah, so it was interesting when I was reading it back then. But I was very female midwife only. I would not see a male OB. That was not something that I was open to at any point, which is probably heavily influenced by the fact that I had grown up with my best friend's mom being a female midwife. But yeah, the history of it is just so, and then the way that it affects, you know, all of this stuff that we were talking about in chapter 2, of completely unevidence-based practices that come from that. The very beginning of this book isn't a super positive vibe. But it gets better, I promise.
But I thought it was really informative though. And like,
So informative.
it was cool to see how she really she realized, oh, I hold the power.
Mm-hmm.
So I have to make the plan.
Yeah. What were your final takeaways from chapters 1 through 3? Were you leaving it feeling, or your ending thoughts? Cindy? Okay.
I left these fired up.
She said she left fired up. Her walking away feeling from chapters 1 through 3 is just being fired up.
Yeah, ready to go, ready to
Mhm.
change everything about maternal health care. So
Yep.
like if you want to go storm a hospital or take down anything.
But before, right. What about you, Becca? What were your final
Build a
thoughts?
nonprofit.
My final thoughts were I want to read more. Like I wanted to keep reading, to keep learning, and to keep growing.
Good.
Like I said,
Do that.
I'm not a big nonfiction reader, so for me to be able to sit down and say I want to keep reading is pretty. It says a lot.
Awesome. What about you, Jamie?
Honestly, I was like so very aware of all the stuff that she had talked about at the beginning of the book that I was pretty much like, yep.
That's where I was at. Mhm. Yeah, this is, yep, exactly. Mhm. Yeah, I remember the first time that I read it, I was very inspired by the fact that she, as a part of the medical community, was being so open about it. That was, you know, sometimes it takes somebody with the right credentials speaking out. And I know that had to be really hard for her. And, you know, she does teach about the horizontal violence experienced in hospitals and stuff where a lot of the things that are going on in hospital rooms, it seems like it's the hospital staff that are implementing it, but it's actually bureaucrats doing hospital policy. And so I was thinking about that. I had actually taken that training before I read this. So I was thinking about that the whole time, where I was thinking, and where we want to make the changes and where your instinct is to make the changes is you're fired up from this. It's actually not going to do you any good because you have to get to the bureaucrats. Good luck for that. Which might be why the changes are so slow, honestly. If it's all lawyer driven and, you know, the people who actually had probably never been in a birth space.
Yeah, that's a big part of it.
Part of it. Mm-hmm. And so then, you know, you're fighting hospital policy at that point. And so that was in my head so strongly the whole time that I was reading it. And I'm pretty sure that this book was written before she did that class, but I was really wishing that that had been in there a bit more. Because it's really easy to talk about it and to just like get infuriated by the situations that arise from it, and to just like almost like you're mad at the messenger with the hospital staff. And I kind of wish that that had been talked about more. So I feel like we get fired up for the wrong things sometimes, but
Yeah.
that was my, and then of course, the whole time that you're reading about the history of birth, it's just like,
Yeah, it makes you just mad. It like made me sad for like my grandma who had 5 kids, and like I never got a chance to ask her about her birth stories, but if she were still here, I would have asked her about it, and I can almost guarantee she had a twilight sleep experience. And it makes me sad for like my mom and even my sister who have had birth experiences that could have been so much more empowering if they had had a little more education and like hospital policies and staff that were supportive of that.
Yep.
So it makes us want to make a change for those,
Yeah.
for the future,
Makes you want to get out there and
make a difference.
see what we're doing.
Mhm. For sure.
Awesome. Okay. Yeah. This was great. Really great participation. Thank you guys for coming. And we will be meeting next month, same time, same place.